Acute coronary syndrome, or ACS, occurs when blood flow to the heart muscle is suddenly blocked, usually by a blood clot in a coronary artery. There are three main types of ACS: ST elevation myocardial infarction, non-ST elevation myocardial infarction, and unstable angina. Prompt recognition and treatment of ACS are crucial to minimize heart muscle damage and improve patient outcomes. Common symptoms include chest pain, shortness of breath, nausea, and sweating. Chest pain, often described as crushing or squeezing, can radiate to the left arm, jaw, or back. Remember, time is muscle when it comes to ACS. If you or someone you know experiences these symptoms, seek immediate medical attention. Calling emergency services is the fastest way to get to the hospital for diagnosis and treatment. The European Society of Cardiology, or ESC, regularly updates guidelines for managing cardiovascular diseases. The 2023 ESC guidelines for ACS management emphasize early and aggressive treatment. Rapid diagnosis and risk stratification are crucial. This helps determine the appropriate level of care and identify high-risk patients needing intensive treatment. A multidisciplinary approach involving cardiologists, nurses, and pharmacists is essential. The guidelines incorporate the latest scientific evidence and clinical trial data. They serve as a valuable resource for healthcare professionals to ensure effective and up-to-date care. STEMI, or ST elevation myocardial infarction, is the most severe type of heart attack. It occurs when a coronary artery is completely blocked, interrupting blood flow to the heart muscle. Rapid restoration of blood flow is crucial to minimize heart muscle damage and improve survival rates. The 2023 ESC guidelines recommend primary percutaneous coronary intervention, or PCI, as the preferred treatment. PCI, also known as angioplasty, uses a catheter to open the blocked artery and insert a stent. PCI should be performed within 90 minutes of first medical contact. If PCI is not available, fibrinolytic therapy should be administered to dissolve blood clots. Patients are then transferred to a cardiac intensive care unit for close monitoring and further management. NSTEMI and unstable angina are less severe forms of acute coronary syndrome compared to STEMI. They occur when a coronary artery is partially blocked, reducing blood flow to the heart muscle. Initial management involves medications like antiplatelet agents, anticoagulants, and nitrates. Antiplatelet agents prevent blood clots, anticoagulants prevent existing clots from growing, and nitrates widen blood vessels. The decision to proceed with invasive strategies depends on the patient's risk stratification. Coronary angiography uses X-ray imaging to visualize coronary arteries and assess blockages. High-risk patients benefit from early invasive management. Lower-risk patients may be managed conservatively with close monitoring and medical management. This approach aims to stabilize the patient's condition and assess their risk for future events. Further investigations or interventions can be considered if necessary. Risk stratification plays a pivotal role in the management of acute coronary syndrome. It involves assessing the likelihood of future cardiac events such as heart attack, stroke, or death. Several risk scores like the GRACE, TIMI, and PURSUIT scores aid in risk stratification. These scores consider patient demographics, medical history, and laboratory test results. High-risk patients benefit from aggressive treatment approaches, including early invasive procedures. Lower-risk patients may be managed more conservatively, focusing on medication optimization and lifestyle modifications. Accurate risk stratification helps healthcare professionals optimize treatment plans. Personalized treatment plans improve patient outcomes. They reduce the risk of future cardiac events. Following an acute coronary syndrome event, patients require ongoing care and support. Follow-up care involves regular checkups with a cardiologist, medication adherence, and cardiac rehabilitation. Cardiac rehabilitation includes exercise training, education on heart-healthy living, and stress reduction counseling. Exercise training improves cardiovascular fitness. Education provides knowledge and skills for making healthy choices. Lifestyle modifications are crucial for long-term cardiovascular health. These include quitting smoking, eating a heart-healthy diet, engaging in regular physical activity, and managing stress. Smoking cessation is essential as smoking damages blood vessels and increases the risk of blood clots. A heart-healthy diet emphasizes fruits, vegetables, whole grains, and lean proteins. Regular physical activity strengthens the heart muscle and improves blood flow. Stress management techniques like deep breathing exercises or meditation reduce strain on the heart.